topic for today is all about infrastructure and Lucena City, Quezon Province.
So, what are the urban health services, basic services, government initiatives, and programs in the Philippines city of Lucena in Quezon Province? And what the potential answer that will assist in resolving the issue? Lucena is highly urbanized city located in the province of Quezon. Philippines, it is strategically located between the major metropolis of Metro Manila and Bicol region, making it a hub for transportation and commerce with a population of over 266,248. Lucena is considered as one of the fastest growing cities in the province. Despite its rapid growth, the city is faced with health and basic services challenges. It is noteworthy that health facilities are often inadequate in rural areas, which can cause a strain in the population of the city. Basic services such as clean water and sanitation are also limited in some barangays and slum areas, hence exposing residents to susceptibility to poor environment condition. The government has implemented various initiatives and programs to address the issues, but they are still far from being resolved. The urban health services in Lucena City are geared toward promoting healthy development, safety environment, and coordinate preventive care. The City Health Office provides numerous medical services to the residents, including a family planning vaccinations program and HIV testing. Among others, on the top of that, they organize various health awareness campaigns, including diabetes and cancer prevention. The basic services in the city include access to clean water, sanitation, and solid waste management. The city's government has installed pump wells in several barangays, public latrines or latrines, and waste segregation program to their delivery of basic services. However, the implementation still need improvement as the environmental issues are still rampant in many areas. Government initiatives and programs have been introduced to address the issue of inadequate health and basic services. Lucena City Office of the Mayor has spearheaded efforts to expand the city medical capabilities and enhance infrastructure, including road and development and providing essential utilities to residents.
In conclusion, although Lucena City has made progress in improving urban health services and basic services, several challenges still need addressing. Government initiatives and programs must target the most underprivileged resident and think of the innovation or innovative solution to enhance the delivery of essential services. The potential solutions may include health programs targeted at rural areas, public-private partners, and increasing residents' involvement in service delivery.
Lucena City, being one of the highly urbanized city in the province of Quezon, boasts of a sufficient number of health facilities scattered throughout the city. The health infrastructure of Lucena City consists of several hospital clinics and other healthcare centers that serve the citizens' medical and health needs. There are prominent hospitals in Lucena City: the St. Anne General Hospital, the Lucena United Doctors Hospital, and the Quezon Medical Center. This hospital offers different medical services and equipped with state-of-the-art facilities and equipment. Aside from the hospital, there are so many numerous primary health care and centers and barangay health centers that cater to medical needs of the community, most vulnerable sector, especially those living in a remote areas. Moreover, Lucena City has several private clinics that offer specialized medical services such as dental services, dermatologists, ophthalmologists, and other. The city also has a blood center and a daily center which cater to patients with blood-related disease and those in need of dialysis treatment. Despite the availability of health facilities, there are still challenges that the city faces in terms of providing accessible healthcare services. That one of the major concern of the distribution of hospital and clinics. The healthcare facilities are mostly situated in the urban areas of the cities, which means the individual residents in the remote areas have limited access to medical services. This gap creates disparities in increasing primary health care in services, which is essential in keeping the local population healthy. In conclusion, Lucena City has a vast health infrastructure that caters to the medical and health needs of its citizens. However, certain improvements are necessary to reach and provide healthcare services to the remote areas to of the city. Therefore, the authorities need to look into and take necessary measures to provide medical services more equitably and geographically linked with primary health care. Lucena City is a bustling urban center in the province of Quezon. The boast of a comprehensive healthcare system. Medical institutions in the city range from public hospital, community health centers, and special clinics that cater to different medical needs. Accessibility of healthcare serving in Lucena City is considered relatively high thanks to its strategic location in the heart of Quezon province, which is accessible to urban and rural communities. Moreover, public transportation is widely available, making it easy for residents to travel to different medical facilities in the city. Despite the availability of healthcare facilities in the Lucena City, the cost of healthcare services remain the major concern for many Filipino. This is due to inadequate government funding and the highly cost of healthcare services, which can be a burden for many low-income residents. However, there are programs and services available to have individuals obtain affordable healthcare. The Philippines Health Insurance Corporation, or PhilHealth, is a government agency that provides affordable health insurance coverage to Filipinos. In addition, some medical institutions in Lucena City offer a discount and flexible payment schemes to make healthcare services accessible to making working class. In conclusion, while Lucena City has a developed healthcare system, health affordable and accessibility remain a challenge. It is important for the government to continue investing in healthcare infrastructure and implement policies that will help alleviate the burden in low-income households. In conclusion, Lucena City in Quezon Province, Philippines has a growing number of health infrastructure facilities that cater to the health needs of its population. The government has been productive in investing in the healthcare sector, but there is still needs of an improvement in terms of accessibility, quality, and affordability of healthcare services. Several challenges face the healthcare system in Lucena City, such as inadequate funding, lack of healthcare professionals, and limited access to essential medicines and technology. Nevertheless, Lucena City has a potential to further improvement and expand its healthcare system by addressing these challenges. For future outlook for health infrastructure in Lucena City includes the construction of additional health facilities, the recruitment and training of more healthcare professionals, and the development of telemedicine services, the integration of technology and healthcare, improvement of the quality of the delivery of healthcare services, making them more accessible and affordable to the people. Overall, health infrastructure in Lucena City has made progress over the years, but there is still much room for improvement. The government and private sectors need to work together in addressing the issues that hinder the development and expansion of the healthcare system in the Lucena City. Urban health services available in Lucena City. Lucena City, located in Quezon Province in the Philippines, has several urban health services available for its residents. These services include Lucena City District Hospital, St. Anne General Hospital, Lucena United Doctors Hospital and the Medical Center, Barangay Health Center, City of Office. Aside from the above mentioned urban city services, the government of the cities also implemented the service initiatives and programs to improve the overall health and well-being of its residents. First, Health Facilities Enhancement Program. The second, Barangay's Nutrition Scholar Program, Adapt Health Center, and Upland Tokhang.
Lucena City, located in the province of Quezon in the Philippines, offers various urban basic services to its residents. These services include health services. Lucena has multiple hospitals, medical clinics, and health centers that offer various services to residents, including emergency care, vaccination, family planning, and consultation. Educational services. The city houses multiple schools, colleges, and universities where children can get an education. These institutions offer primary and secondary education that is free and accessible to all children. Waste management services. The city has a comprehensive waste management system that collects and disposes of waste in an environment-friendly manner. These services ensures clean and safe environment for residents and visitors. Water services. The city has a well-established water system that provides clean and safe drinking water to its residents. This service is available to all households in the city. Transport services. Lucena has well-connected transport systems such as buses, jeepneys, and tricycles that cater to its residents and visitors. These services make it easier for people to move around the city at an affordable price. Electricity services. The city provides reliable and affordable electricity services to its residents, which enable them to operate various electrical appliances and run their businesses. In conclusion, Lucena City provides basic urban services to its residents, which are essential for their well-being and daily living. The government should continue to provide these services and, if possible, improve on them to make them more accessible and efficient. Through regular feedback systems, the government can gain insight into the needs of the resident and address any issues that may arise in the urban basic services sector. Challenges faced by urban basic services in Lucena City. Lucena City, like any other urban areas in the Philippines, faces various challenges in providing health to its growing population. These challenges include inadequate health facilities. Although Lucena City has several health centers and hospitals, the increasing population has put a strain on these facilities. There is a need to expand and improve existing facilities to cater to the growing demands of the community. Lack of medical professionals. Lucena City also faces a shortage of medical professionals, especially in rural areas. The government needs to implement programs to incentivize doctors and other medical professionals to work in these areas. Limited access to health care. Many people in Lucena, particularly impoverished areas, have limited access to health care services due to financial constraints and other barriers such as transportation. Insufficient funding. The government budget of health services in Lucena City may not be enough to address the growing needs of the community. This may result in an inadequate provision of basic services program. To address this challenge, the government of Lucena City should prioritize the following potential solutions: increase the number of health facilities and improve existing ones to be better catered to the growing population. Implement programs that will encourage medical professionals to practice in rural areas. Provide subsidies or financial assistance to make accessible to marginalized communities. Allocate more funding to health services to ensure its sustainability and efficiency. In conclusion, urban health services in Lucena City face various challenges that require immediate attention and solution. A concentrated effort from the government, health professionals, and the community necessary to provide sufficient and quality health services to everyone. Lucena City is a highly urbanized city located in the province of Quezon. Despite its progress, the city still faces challenges in providing basic services to its residents. Here are some of the challenges that affect the urban basic service in Lucena City. Inadequate access to potable water. Some areas in the city still face difficulties in accessing clean and safe drinking water. This is due to the limited supply of water from nearby water sources. Poor sanitation facilities. Some areas in the city lack proper disposal and treatment facilities for waste and sewage. This poses health risks to residents and may lead to the spread diseases. Traffic congestion. Lucena City is a busy commercial center and its thoroughfares are usually congested with vehicles. throughout the day. This causes delay in delivery of basic services such as garbage collection and emergency services. Limited public transportation. The availability of affordable and reliable public transportation remains a challenge in Lucena City. These affect the mobility of residents and may hinder their access to basic services such as healthcare. Informal settlements. The city is home to several informal settlements. They lack proper housing and community services. This increases the vulnerability of residents to various health risks and exposes them to environmental hazard. In conclusion, despite the challenges faced by urban basic services in Lucena City, the city government continued to exert efforts in finding solutions to improve the quality of life to its residents through collaborative efforts from various sectors. The city can ensure the provision of basic services to all citizens. Challenges faced by government initiatives and programs in Lucena City. Despite the effort of the government to encourage community participation in health and basic services program, there is still a lack of engagement from residents. This affects the sustainability of initiative and limits their effectiveness. Some of the challenges include inadequate infrastructure. Lack of proper infrastructure poses a significant challenge providing basic services in Lucena City. The health centers are not enough to cater to the growing population, and some of them lack essential medical equipment supplies. Limited human resources. This is a lack of qualified medical professional, staff, and volunteers to implement and manage the health program. This affects the capacity of government initiatives to cater to the community health needs, especially in less accessible and remote areas. Low community participation. Despite the effort of the government to encourage community participation in health and basic services program, there is still a lack of engagement from residents. This affects the sustainability of initiative and limits their effectiveness. To address this challenge, there may be potential solutions that can assist the government in resolving this issue. One possible solution is for the government to increase funding allocation and take measures for efficient use funds. They can also implement policies that subsidizing healthcare professionals, staff, and volunteers to serve in less accessible areas to improve the community access to health services. Another solution is to engage the community actively through awareness campaigns and education programs to promote community participation and foster a culture of health and well-being. Finally, the government can work on developing proper infrastructure and implementing programs that address the specific need of community and improve their quality life.
Despite the city's rapid development, it still has serious health difficulties. As a result, the Lucena City government has launched a number of initiatives and projects targeted at delivering basic services and strengthening urban health services in the city. The city has comprehensive health programs that aims to provide comprehensive health services to its constituents. Under this program, the city operates several health centers that offer primary health care services, such as prenatal care, maternal and child care, and general medical consultations. The city also has a nutrition programs that aims to improve the nutrition status of its constituent, particularly the children. This program provides the following: nutritional counseling and supplements, conduct feeding programs, and advocates for healthy eating habits. The city government also provides free vaccination for preventable diseases like measles, polio, and tetanus. They also provide basic services including water sanitation, waste management, and transportation, with the water system, sanitation programs, waste segregation, and public transportation system. To address the issue of traffic congestion in the city, the government has implemented the Lucena City Traffic Management System. The system aims to regulate traffic flow in the city through the installation of traffic lights and the implementation of a one-way traffic scheme and the construction of additional roads and bridges. However, despite these initiatives and programs, there are still several challenges that needs to be addressed in the city, such as inadequate health facilities, inadequate water supply in some areas, and poor sanitation practices. To address these challenges, the government may need to increase its investment in health and basic services and adapt to an innovative solution, such as public-private partnerships and community involvement. After discovering the different challenges faced by urban health and basic services in Lucena City, I tried to come up with some potential solution on how they can address these problems, and it is the following. The first one is by developing a comprehensive community health program. Lucena City could initiate a community-based health program focused on primary healthcare services. This program should include regular health checkups, basic health services, and follow-up for patients, especially those with chronic diseases. The program should aim to cater to the health needs of different age groups, including women, children, and adolescents. Second, is strengthening the health infrastructure. Lucena City could initiate a feasibility study aimed at strengthening the existing health infrastructure. The study could suggest upgrading the existing healthcare facilities by providing equipment and resources, expanding the current hospital and health centers, and building a new healthcare facilities where necessary. By doing so, the city could improve its capacity to provide health services, increase patient access to quality healthcare, and reduce the burden on existing healthcare facilities. Third, Lucena City should invest in healthcare technology. The city could explore the use of healthcare technologies such as telemedicine, e-health records, and mobile healthcare units. These technologies could improve health services accessibilities and reduce the cost and time of medical consultation. Telemedicine services in particular could greatly benefit the city's remote areas where access to medical healthcare is scarce. Fourth, creating public health awareness programs. The city could initiate public health awareness programs aimed at educating the public on healthy living practices and preventative healthcare measures and specific health concerns. By leveraging on community health workers, health events, and social media channels, the city could promote healthier living and reduce the incidences of preventable diseases. And lastly, political will and interagency collaboration. Lucena City government could foster interagency collaboration and healthcare planning and implementation. There should be strict accountability and transparency in allocating healthcare budgets, ensuring timely disbursement, and monitoring project implementation. At the same time, the city should prioritize healthcare in its political agenda, commit to ensuring and protecting the right to health, and work to establish a more equitable health system. Creating sustainable urban health services and basic services is vital in improving the overall quality of life in Lucena City. This potential solution presents a roadmap for the city to overcome the challenges it is currently facing and to create a healthier and equitable community. In conclusion, it is evident that Lucena City in the province of Quezon has various urban health services and basic services, including hospitals, health centers, schools, markets, and transportation. The government has initiated programs and initiatives such as PhilHealth, DOH, and DSWD to provide affordable healthcare, education, and social welfare services to the residents of the city. Despite this effort, there are still challenges that needed to be addressed to improve the quality of life of the people in Lucena City. One potential solution to resolve the issues of urban health services and basic services in Lucena City is to increase funding for healthcare and education. This could be achieved by allocating more budget for healthcare centers and schools and providing more incentives to the healthcare professionals. The government can also collaborate with private companies and non-government organizations to provide better healthcare and facilities and social services, especially to the marginalized sectors of the society. Another approach is to implement stricter regulations and policies that would require public officials to invest in urban health services and basic services. This can be achieved through adopting sustainable development goals, re-evaluating zoning laws, and enforcing stricter building codes. The local government could also appoint a task force that would oversee the implementations of programs related to urban health services and basic services. In conclusion, the city of Lucena in the province of Quezon has a vast potential for improvement in its urban health services and basic services. Initiatives by the government coupled with private sectors can provide sustainable solutions that would improve the quality of life for its residents.